Okay. Hi, we are back. Dr. Z, it's so good to see you. How are you today?
I am doing okay. Thank you for having me back. How about you?
Doing well, doing well. We got past the, graduation week, though I do think that there are a lot of graduations going on. And so it really prompted for me to really think about the other thing that's happening this month, which we are wrapping up, but I think is always important for us to share on, and that's mental health awareness. It's mental health awareness the month of May, and I think mental health awareness for every month. And so I wanted to talk to you about that today, and to just ask you with our different age groups, because we don't know what parent is listening. We have some that may have younger children that are elementary, middle school, high school. But why is it important to introduce mental health concepts to our children, period?
I think I'm glad that May we celebrate as a mental health month, and as you mentioned, we need to talk not only in May but all year around. And the reason to talk about it so that we can help our children to share their thoughts and don't feel ashamed, embarrassed when they are going through some difficult time. Because many times what I have seen, especially with my um, clinical interaction, we may unconsciously making our children feel they're feeling happy, feeling successful. All those things are normal feeling, but feeling sad, feeling down, feeling embarrassed, feeling scared, these are not normal or not often talk about. So what happen is, remember, our children, they learn from us. So if we
Mhm.
only talk, or if we talk most of the time, the happy feelings, we celebrate those things. But when someone is sad, mad, or angry or frustrated, we don't create a safe space where they can share, then they may think that these are normal feelings. These are not normal feelings to talk about. And they start keeping things inside. And as we all know, when we start piling up, and that suddenly, something happen and a big blowout happen, and we may see in some of people around us, and that is usually not a healthier way to express those feelings. So I think
Mhm.
so today, I hope that we will be able to share what are different ways and why it is important to create that space so that our children feel safe to share about their feelings.
Absolutely. I wholeheartedly agree. And I think that it's an important conversation to have. And oftentimes, I think that even as adults, there's a bit of a struggle in understanding what mental health really is. And so, with that, I wonder if you can share some ways that we can explain the concept of mental health to our children depending on their age. So how would you suggest explaining it to our elementary student versus our child that may be in high school?
I think so. I'm glad that we are doing it, as per age, because I agree how you explain to an elementary student is different than how you explain to a high school student. So I think one thing I would say is, especially in elementary school, they are very concrete and they are very simple in terms of, their understanding. So I think I would explain is more, just like, sometime your tummy hurts, sometime you may feel like throwing up. Sometimes you may feel like, headache. So just tell them that these are some symptoms, sometime we may experience. Similarly, sometime and that, so these symptoms are telling that something may be not right with certain part of the body. So you
Mhm.
can say similarly, sometimes we feel sad, sometimes we feel down, sometimes we feel scared, sometimes we feel frustrated, and sometimes we feel angry. And these are also just like a pain in a belly may show something is going on in the tummy area. Pain in, headache may show something maybe going on in the head. So similarly, when we have these emotions, so maybe something is happening in our life that we are feeling that way. And just like, whenever we get tummy ache, we talk to the grown up and to mostly our parent or teacher. Similarly, when we feel sad, down, scared, anger, frustrated, or any kind of those feelings, it's important to share with the parents as well, so that we can help, and we can you know help them first to understand those feelings and also what need to be done.
Thank you for sharing that. And as I was listening to you share that, I thought to myself, I always think of all these questions. I'm like, oh, I can't wait till we have these conversations so I can ask all my questions, because you have a way of explaining things in such a way that I can understand. And one of the things that came up for me is, what are some of the common misconceptions where mental health and children are concerned? Because I can share one with me, is that I would have never really thought to talk to my elementary school child about this. Why? Because to me, which I now think is a misconception, I think, well, they're kids. What do they have to be sad about?
Mhm.
I don't need to have this conversation. That isn't something I need to talk to them about. I think that's a misconception that we have. Our kids are definitely struggling with mental health things in different ways that maybe we as parents don't understand or expect. It doesn't mean that it's not there. So, is that a common misconception? And what are some other ones that you can share?
I think yes, that is a common misconception, and a lot of time parents, they may think that when they were growing up, they may have had similar feelings, and parents may not be able to understand, but they are turning out okay. Some are engineers, some are doctors, some are teacher, some are business men, women. So they may think, okay, these are just, they are over time, they are going to overcome it. Why to bring those up? And many time parents may see, oh, but the child is getting good grade, the child is doing okay, like why to bring these issues, because these are very painful things to bring it up. And sometimes it brings our own painful memories attached to feeling sad, feeling mad, feeling angry. And it's very easy to just not think about it, to just numb. That's where the social media, that's where the drinking, that's where all these things come, that we intentionally, our brain by default is try to avoid and not talk about it. Even you can see, even in grown-ups, you know if you don't like if you don't like about something that the other person say, there is a likely the people will avoid it, or maybe try to go around, or try to but not talk to that person directly, because just very hard conversation sometimes to have.
Mhm.
So that's a normal hesitancy that the parents may feel bringing those topics. So what I would suggest is, sometime I often suggest people to have the story. Let's say, in a story, if or even in a movie, if a child feels sad, and you can say, what do you think when the other person took away that toy from what do you think the child was feeling? And
Mm.
let them say, they may say, oh, they may be frustrated or angry. And then you can take a pause. Have you ever felt that way, that someone took away? Remember when your brother Johnny took away that thing, and you were really upset, and you start fighting, screaming? Do you remember, when you got mad? And if the child say yes or no, then you can say, tell me a little bit more. In the beginning, you will see the many child will not wanting to talk. They said, mommy, I just want, please just stay, focus on the story, I don't want to talk about it. And that is okay as well. But at least bringing those stories and nudging them a little bit. And so don't try to push, don't try to push them to open up to you, don't try to push them to share all those things. It happens slowly, but I think you will see the kids show interest. Sometime I have seen the kids say, okay, you just read the story and I will just cover the face, but they are listening the
Mhm.
story. So don't stop it, keep doing it, and gradually see when it's a good moment that they can share. But please
And
do.
yeah, I really appreciate you saying that part too, because that was, you answered a question that I had, is how do we start that conversation without it being like intimidating or overwhelming? And I love that you said, don't push. It's okay to not push. And I think as a parent, well, I mean, I'll just admit that I can freak out and I want to push and I want to say, no, let's talk about it. No, it's good to talk about your feelings. No, like we're not going to shut down. No, we need, and well, I mean, I think if I put myself in their shoes, that will most definitely have me shut down even more if
For
someone
sure.
was doing that to me.
Mhm.
So I can really hear what you're saying in that, and to give them the opportunity to kind of come around to it. And I love what you shared about asking them such and such. Do you remember when this happened in this movie? Do you ever feel that way? Or, things like that. I think that's such a great idea. And I wonder if there are any specific books or resources, even if there's a book for a child that you recommend, or maybe there's something that a middle schooler can read. Is there anything that is out there that could be a valuable resource for us in mental health awareness?
Yes, I think I really like the dragon series. So train your dragon to teach kindness, to teach empathy, how to manage the anger. So that's a really good book, especially for the elementary school. They really like, how they are, the dragon, how the child is able to teaching the dragon and teaching manners. So I think the dragon series is really good. So teach your dragon. I think that's, and the second thing is the spot. I think the spot of anger, spot of sadness, spot of, so those are also good, where they show you, how you can express how when you get upset, your spot of anger keep getting big, 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 and what are different ways to make that sport, what are different ways to bring the happiness spots more during the time. So I think that that is another good book I would like to share, good resources to have. And I think there is another on I think on YouTube, listening with your heart. I think that that's some really good story book is also in the book form, where they teach how, if you made a mistake, don't try to just get mad and criticize, and how you bring kindness when you made those mistakes. So that's another good one to listen and to watch as well.
Okay. And I'll make sure that we put those in the description of the podcast for the parents that are listening, just so that they have the correct title and they're not wondering if that they have the correct one. I think those are great. I'm intrigued to read the spot one. It made a lot of sense to me. I'm such a visual person that when you said that, I could envision the spot getting bigger and smaller. So I think those will be really good tools. How can we as parents model healthy emotional habits to our children? So what are some examples of behaviors that children might copy or emulate that maybe we can turn around for a positive way?
I think one way, our children, they are, very attached to us. Even most of the time they may not show, but they feel it.
Mhm.
Like, for example, when both parents, let's say if they are raising together, or even the parents who are separated and raising, either joint custody, so they can see the tension when among parent is. So I
Mhm.
would say, rather than hiding, sometimes you can, and sometimes the emotions are too high, you are not realizing it, and you are saying things, that are out of anger to the other partner. So when you things settle down, you talk to your child. I know that I saw you, that you were feeling a little bit worried, scared, and I would like to talk about it. Is it okay? So get the permission. Don't just you had the big argument, and now you want to talk to your child. So is it okay that we want to talk about? And if the child say no, you can say, when is a good time? Because I think it's very important to, so that we don't want you to feel scared. And I can, I know that um, we had a disagreement, but I think raising voice, saying bad things to each other was not the right thing to do. And I already spoke to, my partner, your dad, my husband, my wife, that we should communicate. So you are bringing those, the conversation to it. And if the child agrees, then you can talk. What were you feeling? Is that right, that you were feeling sad, you were feeling mad? And if the child say yes, and then you can say, yes, I think that's a very normal feeling, especially when when the people that you love the most, they are raising their voice, and it's very common to feel sad, it's very common to feel scared. And you can share, sometimes I also feel sad, when I also feel, when I disagree, or when I get into the argument. Let's see how we can, and if and children are very, very smart. You can ask them, what do you think what happening in that moment? Why do you think we were, having that argument? What do you think we should have done? And they will say pretty silly things, but they are getting part of the conversation. And don't say, and don't go into, the explaining, no, that's not right, no, that, you just listen to them, What you were saying is that instead of yelling and screaming, we should have talked nicely to each other. Maybe we can try. What do you think we can do differently? So allowing them be part of that conversation and bringing you in the picture, then bringing back to them, is there any other time you felt sad, you felt scared? Did it ever happen that in school? Then the child may start opening up a little bit, and then you will start realizing where some child they feel more angry, some feel more anxious. So where they are going, then you can bring a little bit more example and have that, the regular conversation. But I think role modeling to them that, disagreement is it's pretty normal, but the yelling, screaming, saying mean things are not the way to express the anger. But I think how we can learn from that experience, and how they can share their views as well, no matter how silly and how simple those are.
Yeah, I mean it's very validating, I think, and important for children to feel seen that they can share that and it be a safe space to do that. And I have heard a lot about this, about art and music and play therapy and things like that. So, is there a role in that for parents to maybe also figure out a way to give a child an outlet with art or music or play in order to process some mental health awareness concern? Or should that really only be something that is left to a mental health provider or a professional?
I think there are a lot of ways we can utilize these tools, and I will go over what are some warning signs where you need professional help as well. I think the arts, drawing something, can you, or if the child is having difficulty, there are happy, sad, and mad, and all those faces, so they can point out.
Mm.
And then also, some kids are good at drawing, and then you can, from the draw, they can explain, like they may have a hard time sharing what they were feeling, what mom and dad are arguing, but they may draw. So can you draw the situation? What do you think was happening? What do you think each person was feeling, and what do you would like this picture to be different? So they may be more open to it. Asking them to journaling it, and I think I know sometimes kids like to write letters and small notes, so those are some of the things, yes, if you anytime you feel that I have done something that upsets you and it's hard for you to say it, you can just write it down, mama, what you said, this thing that really made me sad. Or anytime if I do something that you like it, you can, so those are another way to let them to express. And then you can also have some pretend play, with some toys. When the kids are playing, you can participate, you can be, the one, there are a lot of stuffy, the stuffed toys, and or those, so those are the other way that, you can be one character, the other can be the other character. Music is another way, you can bring, that is also soothing. Some kids, they are very sensory seeking, deep pressure, massage, even, kids especially who use a lot of deep pressure, I often say weighted blanket, body socks, all those are pretty, good, that, where they can feel safe and feel a little bit more contented, in those situations.
Now, is this something that can also be tried with an older child? Like, say you have a teenager, because I feel like sometimes we may have teenagers that are open to that, and then most of them are like, I'm not going to do that. That's, silly, or, however they feel about something. But is that something that we can incorporate with our teenagers as well?
I think we need to let our teenager to be who they are. If they want to be silly, I think the home need to be a landing pad, safe space where they can be who they want to be, even
Mhm.
though they are 17-year-old. But if they want to, curl up in this body sack or body socks, or in this weighted blanket, or in this yogi bow bean bag thing, I
Mm.
think they need to, so that, they can let it out, they can be silly, they can be funny, and, the parents can also join. Even for grown up, they can also join, so joining them in there. So I think it's just a really good way to let them, especially people, especially children and teenagers who seek deep pressures. I think these things can be very helpful.
Yeah, I agree with you. I think just giving them the safe space to express themselves how they need to, maybe even just having that opportunity and not assuming, and I'm talking to myself because not assuming that maybe a child because they're a teenager may oh they won't need that or they're going to think it's this, that, or the other. Just letting them have their own things,
Mhm.
I think is really important. I think it's also important as a family unit to acknowledge mental health awareness and why we have a whole month that's dedicated to it. So, what are some things that families can do to create maybe a meaningful tradition or an activity during Mental Health Awareness Month so that there's emphasis placed on the importance of it?
I think have some family time together, if not daily, but sometime in a week, and where we can have, if these are younger kids, we can have a story time, where we can have a pretend play, we can have, a movie that are around bullying, and there are so many. So we can have that time where we can discuss those emotions, and if any emotions come, we can provide them that this is a safe space. And sometime we also say parents to have a special time. So this is especially in sibling, at home, if there are siblings, and it's just very hard to have them together. So one sibling can have a special time on Monday, the other can have a Wednesday. So during those special time, you can have the stories, you can have this discussion, and then you can also discuss about the siblings. Remember the weekend, your little sister was about to do this thing, but that really got you upset. And so how we can help together, how we can help them to express their frustration, their sadness, their anger, without throwing things, without yelling. And how we as a parent can also share, remember, and we can make it fun as well. It's very easy for me to tell you, but remember the other day I got really mad at your dad, and I started screaming, and then later I realized I should not have. So these are the some way. Do you remember those? What do you think? What do you think we should have done differently? So I think you will be very surprised. It's hard for children to talk about themselves, but they have a lot of opinion. What you can do as a parent to,
Yes,
to do
that is for
differently.
sure.
Yeah, yeah. So and they can talk. Yeah,
Yeah, I love that you promote inviting the child to also look at us and it absolutely humanizes the parent as
yeah.
well because we do make mistakes and so that is another outlet for a child to talk, and I wonder what some of the long-term benefits of normalizing these conversations about mental health from a young age, like what do you think are the long-term benefits?
I think as we all know, life, we the uphill task is always difficult. you know we
Mm,
want our children to succeed, we want our children to go to good school, be happy, but all these things come with different challenges at different age. Elementary school, middle school, high school, college. So there is no way. One of my teacher told me, the life is a storm, you know and the waves will, and it's not storm all the time. The life is
mm,
an ocean, and there will be storm sometime. you know
mhm,
and the more bigger the ocean is, the more likely, the bigger storm or the bigger challenges might come.
mhm,
But we don't want our children to, it's important to protect us all those storms, but realizing if they are going to, if to do bigger things, they may come across that storm, that big waves. So we
yeah.
need to help them, when those high tide waves come, they
Mhm,
remember, we need to help them that, that our love and our care will be with them, even though
mhm,
when they were struggling.
mhm,
And we need to help them, that they can talk about when if they fell down, if they make any mistake, or so provide that safe space. Yes, making mistake, and remembering and acknowledging that, the reason I am making these mistakes and falling down, because I am going to a bigger journey. So honoring their struggle, and
Mhm.
honoring their, their passion, but acknowledging that, these difficulties might come. So we need to prepare them to ride with those waves. And we
Mhm.
need to prepare them that yes, the bigger wave, there is a likely chance may you can fall, but if you keep trying it, you get better at it. But no matter, either you get better or you are keep falling, the parents are there to help them, to support them, to validate their feeling, and to be with them, to figure it out how to get past this difficult situation. So having that solid foundation and the safety network is
Mhm.
the key for our children, our teenagers, to keep doing and performing the best that the God has given the potential to them.
Yeah, and it really does facilitate. I think it normalizes being able to open up and for them to be able to express themselves and to know that there are opportunities that are given to them to share how they're feeling, and I think that's really important as
Yeah.
well. I think something that is on the top of every parent's mind, and maybe something that you have already thought of and you mentioned actually, what do we do if we as a parent we notice that there's a sign of a mental health struggle in our child? What steps do we take to provide them with the support, but more importantly, seeking professional help? How do we know?
I think if their sadness, their anger, their frustration is happening, let's say, daily basis or most of the days, to the point that it is affecting their relationship with their
Mhm.
siblings, with their friends, their school performance, their or their sleep, their appetite, or you are noticing a significant change in pattern. Let's say they used to enjoy certain activities, but they are not enjoying anymore. They are more isolated. They are more withdrawn, they are more frustrated, they are coming to your room in the middle of the night, suddenly, and or they are having difficulty going to school in the morning, or they are making a lot of excuses to go to school. So these are all the signs, and it is happening on ongoing basis. Then I think that's where, and you have tried, few things. I would say those are the time when, it's important to seek help, and it's pretty normal. Just like if someone has fever, you may take Tylenol, ibuprofen. But if the fever is, every day, 3, 4 days, you tried ibuprofen, Tylenol is not going, definitely you seek out to pediatrician. Some parents seek out even sooner. But those are some of the signs, that, this is the time to reach out. And it's pretty normal. When you reach out to the mental health professional, doesn't mean that you are a failed parent. Doesn't mean there
Yeah.
is, something wrong what you are doing. Is something that you need special help, you know, because the conventional parenting, regular parenting may not able to help. Just like, the Tylenol, ibuprofen is not helping, we need a specialist. Similarly, when your comfort strategies, when the coping strategies, when all the journaling, when all the, the validation is not working, you need someone to help you. You need a person who have done specialized training
Mhm.
to figure it out how they can better help and support. Just like you will reach out to a pediatrician, your gastroenterologist, infectious disease, because they have the special expertise when the main the over the counter things are not working.
And that's such a great analogy to use. I mean, we would try Tylenol, we would try Advil, and if the fever still doesn't go away or the child doesn't feel better, then we seek help. And so we look at what's going on with our child, which can vary. So I love that analogy, and I really appreciate you sharing analogies because it does help me understand in a different way. And I wonder too, what would you say to a parent who was hesitant about discussing mental health with their children? I think a lot of us parents sometimes we get afraid and we think, oh gosh, I don't want to, that's super stressful. What am I going to say? How do I handle this? How would you encourage a parent to talk to them and to not shy away or brush it under the rug, as we say?
I think you bring the child at the core center of the conversation. You bring that, that you are trying so hard to help your child, to support your child. you have done this thing, all those things that the parents have done. And the other thing that like, I will start telling you what you have tried so far. And the
Mm,
parents will start telling, I have tried, yoga, I have tried, the taking them piano lesson, I have tried to take them to, spending more time with them. I'm trying to not be more angry with them. I am trying to take them to those activities. So okay, so then okay, so it seems like you have tried all those things. You name it, after the parent is done, you name it. You tried this, you tried. Look how much you have done because you really care about your child. You really want them to succeed. But despite all those efforts, the child is, more and more feeling more sad, mad, and so, and it seems like pretty exhausting. It might be, causing you to take time off from your work to take the child to these places. It might causing you to not pay attention to the other children in the home, and then pause and see what the parent, and then when they realizing, what they have doing in, and how much it is exhausting and how much it is impacting in other areas, then you bring that, you tried your best, and I'm so happy you are here. And I can see it's really hard to talk about these things because we may think as a failure, and that's why something is wrong in my child, or something is wrong with me. That's the reason, that those things are not working. But sometime, when our children are, when the God has given them some, big things in life to do, and sometimes these hurdles come, so just like a pain can be a blessing, it can
mm,
tell us there is something going on. So
mm,
similarly, these are some signs that something else is going on, that our regular and the conventional and the normal parenting or the strategies is not working.
mhm.
So do you think this is the time to get some additional help? Some parents would say no, and then I will ask them, okay, tell me, how long do you think you want to try more, and what are the other things, because you have tried this thing is not working, what other thing you would like to try? And parents would say, okay, I will take my child, if the child is more angry and more frustrated, I will take my child to the more gym, or to a lot of this the activities where they can boxing, the taekwondo. And I said that that is perfectly okay, just come up with a timeline, let's say 3 months, and you
Mhm.
try all these things. And if it is continuously happening, and you know that you are trying all these things so that your child gets better, but if it is still happening, can we have that conversation again? And
Mhm.
most of the time, that's how, because when the parents see that you are not labeling things, you are humanizing things, you are seeing their efforts, you're not
Yeah.
judging because of their child behavior, they are bad parents, and you are giving them space where they can do what they think works better for them, and you're trusting them. I think there's a likely chance this parent will trust your expertise as well, and more likely to open to what you have to offer.
Oh, for sure. And I always wrap up our conversations with asking you what a crucial takeaway from this is. And I think that what you said now at the end is a huge takeaway. It's remembering that if you do need to seek professional help, that the professionals are on our side as parents to support us, to be there, to encourage us, to teach us, and that we are doing the best that we can. Otherwise, we wouldn't have reached out to a professional.
I agree.
We would try to do something different. But perhaps your takeaway might be different. So if there was anything you wanted a parent to take away with, if this was the last thing that they were hearing before this podcast ends, what would you say would be something you would want a parent to remember?
I think it's very hard as a parent to see your child struggle,
Mm, yeah.
especially when because when they are struggling with the physical pain, you can take to the pediatrician. But when they are struggling emotionally, when they are feeling sad, when they don't want to talk to you, when they are
Mhm.
trying to pushing you away, and you know that they need you the most,
Yeah.
don't give up, you know, be with them. Even if you can't help them, don't give up, you know, even if you can't help them, don't make things worse by pushing them to get your help. Just be there. Just keep telling them, I can see that you're feeling sad, you're feeling mad, and I can see you don't want to talk to me, and that is perfectly okay. but I am here. Whenever you are ready, let me know. Or if anything you want me to do, I'm happy to do. But please, let me be with you during this difficult time and just meet where they're at, meet what pace they are going through, and don't express a lot of your worries with them that they may feel shame, they may feel burden. They know, as a child, I can tell you, our children are very caring, very loving, and they can see if they are adding something in your emotional burden, they are likely to start hiding. So you don't bring your worries, you just tell them, you are here to help, and whenever they are ready.
And, I think for me, just hearing you say that and knowing that parents can come to you and get that support, like there was genuine relief and even tears that came to my eyes
Yeah.
hearing you say that, because I think it's so important for
Mhm.
parents to
Yeah.
know that and to hear that. So thank you for always sharing from your heart with us. I think that, um, having these conversations always brings some sort of blessing to my life. And I hope that this is a blessing to a parent who may have needed to hear this today. So thank you for your time, for your wisdom. And I look forward to the next time that we meet.
Thank you for having me again.